So today let's talk about the spreading of cancer. What really kills most people is the migration of cancer. But the question is this migration random? Does cancer invade different organs randomly? Or does it follow some type of pattern? Well, there's some real credible data out there. I'll put some links down below that suggests that cancer cells were created or derived from macrophages. And macrophages are part of the innate immune system. The word macrophage means large cell that eats, because it will not just eat debris, but it eats viruses, bacteria, parasites, fungus, candida, all sorts of things. And the other thing that's interesting is that many cancer cells behave like macrophages. They actually eat T cells. They eat red blood cells, platelets, just like a macrophage. And macrophages migrate to tissues that need healing. In other words, they migrate to areas of inflammation. A lot of different cancers will migrate to the liver, in the lung, and even the bone. The liver is a constant area of turnover. Same thing with the lung, through the many bacterial infections, through the damage that occurs from smoking and breathing in pollution. And what about all the toxins that come to the liver? There's a lot of damage, inflammation going in the liver. You even have something called hepatitis, and then you have all the inflammatory lung conditions. You have the repeated infections. And the fact that macrophages come from monocytes, which come from bone marrow, that could be another reason why there would be a spread to the bone. And the other interesting thing about breast and lung cancer is sometimes it appears in the mouth following a tooth extraction, which would be an area of inflammation, as well as migrating into the needle tract after a biopsy. In fact, in practice, I remember quite a few people who had cancer in areas of old injury and inflammation. One guy fell out of a tree, hit the back part of his head and is creating damage to his brainstem, and that's exactly where he got his cancer. Another lady had breast cancer, and I asked her, have you ever had any old injuries in that area? She goes, yes, I did. She had major trauma in that area. So cancer tends to migrate into areas of inflammation. And there's even a name for it, inflammation oncotaxis, if you want to look it up. It's also known that tumors can reoccur after years of being in remission, suggesting that cancer can remain dormant for many, many years. Yet, it can be activated by inflammation, even at a distant location in the body. So inflammation could both cause a spreading of cancer as well as an activation of a dormant cancer. And inflammation in general weakens the immune system. And if we take a look at the purpose of inflammation, it's really a response to infection, injury, trauma, stress, oxidation. You have increased blood flow, and you have an increase in white blood cells. And then you have autoimmune conditions right here, which also have this degree of inflammation, and these people have a weakened immune system. So now this is all very interesting, but now what do we do about it? Well, I think it'd be very, very smart to actively and aggressively keep inflammation out of your body, okay? The two best ways to do it are doing intermittent fasting on a regular basis and bringing your carbohydrates way down. That's going to lessen the oxidation factor. Also, regular vitamin D is one of the best anti-inflammatories, not to mention its power in being anti-tumor and anti-cancer. Also, NAC is a great antioxidant that can help clean up the free radical damage that inflammation creates, because a lot of that damage is collateral damage, and that can weaken the immune system as well. Stinging nettle root is one of my favorite natural plant anti-inflammatories. You can also try that. Hyperbaric oxygen therapy is another great way to flood the body with oxidation, because with inflammation comes hypoxia. And even personally, when I do hyperbaric, every single joint in my body feels completely loose. There's no stiffness. I have no inflammation in my body. It's very, very therapeutic. And of course, you can exercise to get more oxygen too, and that also does reduce inflammation. Omega-3 fatty acids can reduce inflammation. If you haven't seen my video on natural anti-inflammatories, I put it right here. Check it out.